We've known for weeks that this virus can affect folks in different ways. Well, the CDC has added 6 new possible symptoms of coronavirus. Here to talk about that is Dr. Vin Gupta, medical contributor, pulmonologist, and global health policy expert, joining us from Seattle. Good morning, Dr. Gupta.
Good morning, Al. Good to see you.
Good to see you. Well, this is really concerning. These new symptoms that they've added: chills, repeated shaking with chills, muscle pain, headache, sore throat, loss of taste or smell, and that's added to added to the symptoms of fever, shortness of breath, or difficulty breathing. How prevalent are these latest 6 symptoms, and how concerned should we be about them?
You know, Al, I can say from the patients I've cared for, a lot of the patients already fit that criteria. I think what the CDC is trying to do is to say, of those that are symptomatic with COVID, let's not make sure we're missing anybody. But sore throat, as you know, headache, as you know, these are non-specific symptoms. A lot of people are walking around with these symptoms, maybe because of another virus, maybe because they have chronic headaches. So we need to be really cautious in how we interpret this advice. It's good that they're making it all-inclusive, but the fact is 8 out of 10 individuals, we think, are asymptomatic that are transmitting this disease, which is why when you have Governor Pritzker talk about testing, that's really important because most people have none of these 9 symptoms. So this is marginally helpful, but I don't think this is a magic bullet by any means.
Given the testing protocols that the federal government announced yesterday, do you think they go far enough, or do they need to do more?
No, I think 2% of the population is a start. It's better than 1% where we're at right now. Broadening who gets tested. So this is a step in the right direction. Right now, it's fever, cough, shortness of breath. So saying maybe if you have one of these additional 6 symptoms, we'll get there. But what we really need is asymptomatic screening. We need people back to work, but they need to be screened. And again, so that's the otherwise healthy. Let's get them a test, and we're not there yet.
After 2 months at home, that quarantine fatigue syndrome is becoming a real thing. And we saw video, beaches packed in California. Folks now coming out as about 20 states now start to open up. What do we need to do to make sure that we don't slide back into a second wave of this?
You know, I'm glad you asked that because public health folks like myself and others, we need to be talking about what's the safe way to get back to normalcy. We already know all the problems. Let's talk about some solutions here. Really, it's going to sound simple, Al, but it's just infection control at the top of mind. Washing hands before and after you go to a hair salon in Georgia. Probably may not have done that prior to that, but now it's going to be top of mind. And most importantly, I say this as a pulmonologist, wear a mask. You know, there was skepticism from everybody 2 months ago. Now the science is clear. Wear a mask. Normal speech can transmit COVID-19. Wear a mask. Those 2 things will allow some semblance of normalcy, I believe, over time, in addition to hopefully a vaccine, maybe a treatment.
In fact, we just had at the top of our broadcast the news that JetBlue is requiring all patients to require masks as they, within their boarding areas and on flights. Is that going to be more the norm?
I think you can not only see it in flight, where we're all contained, breathing the same recycled air. You're going to see that in the workplace. You're going to see that in schools. At least I think we should be seeing it until we feel really confident about the number of cases being circulated, until we feel really confident that COVID-19 is no longer circulating at rates that make us concerned for more social distancing, and we can move towards quarantining, containment, contact tracing. So yes, this is going to be the norm. It should be the norm.
All right, Dr. Vin Gupta, thank you so much. Great advice.